There we go. Okay, perfect. Okay, so I think just to start off, I just want to welcome you and
Thank you.
thank you for giving us, all the viewers, the time. And we have lots of questions coming up for you. But how about just starting off telling us a little bit about yourself and your background and how you.
Sure. My name is Bobby. I'm also a Parmar. I've been a Parmar for 44 years, and I have been practicing naturopathic medicine for almost 18 years now. And so it's been a long time of learning and working in this world, specifically with perimenopause and menopause for that whole time. I've been a very early adopter of menopause hormone replacement therapy and have been advocating for its use for a very long time, even before I started practicing, in fact. And I've just been on a mission to make sure everybody who has any thing to do with perimenopause and menopause knows what they need to know, because we've been misinformed for so long and we've been lied to for so long. And I think those of us who figured it out a long time ago, thankfully, have been working tirelessly to make change here. And only recently the change is sort of like being seen in the regular world.
Yeah,
And so I'm grateful for that, but it's still, there's a lot of work to do. So anytime somebody asks me, thankfully you have a
yeah,
platform that that you'll ask somebody like me to be like, can you just answer some questions? Because there's always
a lot.
still
Yeah,
a lot of like not just misinformation, but just misunderstanding on a personal level of what a hormone is, even.
yeah, it's unknown.
I will
Yes.
take this opportunity and
Yeah.
ask every-
Yeah, for sure. I think first off, just so everybody can understand, like what exactly is like perimenopause to menopause? What happens to a woman during this time? Like I know our hormones kind of go everywhere and then we start to lose hormones, but what happens and how does that affect a woman during those years?
It's like there's many different ways that people have tried to describe this. Sometimes I've used an analogy of like it's a fireworks show. You come for the celebration of light. You first see that in your teens and your 20s and your 30s, the fireworks go up one at a time. And then when you hit your 40s, it's the grand finale. And it's this big just crescendo of fireworks going off all the time. That's
Yeah.
what's happening. You're ovulating regularly once a month,
Yeah.
follicles being released, and
Okay.
then at some point that changes for many different reasons, chemical reasons, brain reasons, genetic reasons. It just changes, and it's a part of the reproductive life cycle. And
Okay.
that in women's 40s, all of the eggs start to be unlinked to each other, unlinked to our brain. And so some get released and then some get released right afterwards. So you get two periods in one cycle. You might then not get a period for another few months. And then our body goes, what is this? And
Yeah.
even the natural occurrence, that doesn't mean that our body's reaction has to be like just a peaceful, nothing's happening. Our body is susceptible to it. It's a stress. It's a
Yes.
stress.
Okay.
And so that crescendo is all of these symptoms that sort of are happening as a result of that. Other people describe this as like a roller coaster. It's a puberty that
Yeah.
happens in your 40s. The same thing is just happening in reverse.
That's a good way to put it. Yeah.
Yeah. And so that some women will experience similar transitional feelings, discomfort in their bodies, except for it's not a gaining of hormones,
Yeah.
it's a losing of hormones. And so you don't get hot flashes, night sweats, and insomnia when you're 13,
Yeah.
but you are getting those now because you're in a deficit.
Right.
And but in the process of getting to a deficit of these hormones, because you're not ovulating anymore, so you're not
Yes.
producing hormones anymore,
Yeah.
the body wants to throw out this last remaining follicles, this last remaining eggs.
Yeah.
In doing, you get spikes of hormones. So you get spikes that are all spiking on its way down,
Yeah.
like a roller coaster would. And so that feels also uncomfortable. And it's not just a symptom thing, it's representative. The more a woman experiences symptoms, the more representative it is that later on in life, she's going to have problems that are
Oh,
essentially risks of disease. That's why we worry so much, that we're like, don't just not say anything. Don't just say, this is my life, this is my stress. I
okay.
have kids, I have parents, I'm taking
Yes.
care of everybody. This must just be who I am.
Okay.
Of course, I'm not sleeping. Of
Yeah,
course, and medicine has not done a very good job. It gaslights all the time. Just as like, of course
100%.
you're gonna not be sleeping. You're a woman who
Yeah,
has all these responsibilities. And it's like, what
yeah.
if there's something else going on that could make or break the difference into the way that you feel on a day-to-day basis and the quality?
Interesting. So the symptoms directly correlate to disease that women can get in their later age, and we're just kind of masking that or trying to live through it, not getting any kind of help, and then it's going to burst.
The And this popular Indian people are at we got the short end of the stick
And I
genetically.
actually do want to discuss that. That is my next question. Why are South Asian women going into menopause younger? Why are our symptoms so much worse? And then why does that correlate to more disease for South Asian women?
The main thing that happens outside of like just the change in hormones, right? Everybody experiences a change in hormones because
Yeah,
every woman is going to go through menopause.
yeah,
So at some time or another. But many other factors are involved. One, genetics. Like South Asian people, our genetics are um, always trying to kill us a little earlier than everybody else, and it's for many different reasons.
it's not in
And
my
so
head. Okay.
no, no, it's for both men and women. We've just not inherited the lucky draw on good genes in terms of if we get stressed,
Yeah.
if we have a shift, a change in some way, our body doesn't like it as much as other people's bodies do. We
Okay.
see this
Okay.
in like in other conditions when Indian people move from India to here to British
Yes.
Columbia.
Yeah.
We have the highest rates of Crohn's and colitis in the world.
Yes.
We don't know that why,
Yeah.
but we just know that something happens
Yeah.
when you transplant this group of people from this part of the world over here.
Right.
Something happens. The shift could be dietary, could be who knows what it is.
Yeah.
That shift unlocks a gene that's already there and says Crohn's gets to happen more often and colitis gets to happen more often in younger ages, 3-year-olds, 4-year-olds.
Wow.
And so there's, studies are being done on the South Asian population in British Columbia to be like, why is
Yeah.
this happening? This is unheard of
Right.
in the world. And
Yes.
so we know that there's something genetic there that is a susceptibility. It's no different than insulin resistance. We
Yeah.
have genes that code for our bodies to want to become fat easier than everybody else's.
I agree.
That's why we have thresholds for what weights we're allowed to be, what BMIs we're allowed to be, and what waist circumference we're allowed to be that are way lower than everybody else's.
Yes.
So we're supposed to have waists about 30, 31 inches. We're supposed to have BMIs about 23, 24, not 30, not 27 like other groups. Ours are
Yes.
way lower. And so in menopause, when estrogen goes down, and if we don't replace it, if we allow it to go down and we don't give it back to that person, and Indian women specifically are very resistant
Yes.
to one getting hormone replacement therapy. It's usually a lot more conversation than other people. I think there's a distrust in medicine. I think like when we survey South Asian people, they have the least trust of medicine. Actually, it's Black people are the most distrust, and then it's
Okay.
us
Oh, wow. Okay.
because of like they don't take us seriously. There's a lot of racism in medicine. There's a lot of like misogyny in medicine. So there's a lot of misogyny in society, and so like women's problems and immigrant and ethnic women's problems tend to get minimized,
They
and so
do.
that must feel terrible, and
Yeah.
that must be like an internal like why would I tell anybody this or why would I get help from anybody for this when nobody even listens to me in the first place?
Yeah, I think women try, and you were right. You nailed it before that they get gaslit. Like, you have young children, you're at the peak of your career, you have a household to run, you have a career to manage. Like, of course you're going to be burnt out, and of course you're not sleeping well. But I think it's really important to bring the symptoms first off to the forefront that when women in their 40s, and I guess it's even younger for South Asian women, possibly, right? Am I correct? Yeah. So,
It's the typical age when we talk about guidelines.
yeah.
I'll say two things here. One is when we say the average age of menopause is 51 and a half, we're talking about white people.
Okay.
Uh, because no guidelines will ever separate non-white people from white people. So doctors are given guidelines. Like, here are the guidelines.
Yeah.
And then the guideline says menopause is 51 and a half.
Yeah.
And so then a doctor is going to be like, oh, you're only 43 years old. You couldn't be going through perimenopause because
Yeah.
how could you be?
Yeah.
You're so far away from that. And it's like, well, South Asian women go through menopause at 48. And so
Yes.
it's 3 years, which means perimenopause
Sure.
starts even earlier on that person. You
Yeah.
could be 39, you
Yeah.
could be 40. If perimenopause is the roller coaster or the fireworks that are
Yeah.
10 years before menopause,
Yeah.
and women who are Indian or South Asian go through menopause at 48, that
Yeah.
means you could be going through perimenopause in your 30s,
Yeah.
but
And no
nobody knows that.
doctor is gonna believe that. They're gonna think
They don't
it's
even know because they're given guidelines that say 51 and a half.
yeah. So
Because
what
we aren't counted for, like we're not in the footnotes, we're
no,
not told these kinds of things, and so how are they supposed to know? If they're meant to sort of look at these kinds of things on their own,
yeah,
they're this doesn't happen.
no. So how if say a woman that's listening right now is having some of these symptoms we've talked about and her doctor just like will not listen to her, what would you say the first course would be? Would it be to see a naturopath? Like, I actually want all women to continue to advocate for their health. If they're not feeling right, they know they're not feeling right. So what would they do?
There's a lot here.
Yeah.
One, so like the symptoms are important to know, right? The symptoms that South Asian women experience, particularly more often, are actually mood changes. So
Okay.
it's a lot of the times depression and anxiety as the way perimenopause can show up.
Okay.
The other biggest one, so like we talk about hot flashes and night
Yes.
sweats, but we
Yeah.
overemphasize them.
Yeah.
We say like, oh, if you're not experiencing hot flashes and night sweats, you probably aren't going through this. And
Yeah.
it's like, are you joking?
Okay.
There
Not-
are way more specific things for specific populations. So mental health changes
Yeah.
are anxiety, very much specifically, is
Wow.
really top. It's a
Okay.
priority that women need to think that I'm anxious. I
Mhm.
never used to be this anxious. I never
Yeah.
used to have anxiety. And all of a sudden in my 40s, and then it's like, of course you are. You're taking care of your parents. You're taking care of your in-laws. You're taking care of, it's like, no,
Okay.
eh, you need to be able to appreciate the differences between your life stresses and something happening to your body that's making you less likely to be resilient to your life stresses.
Yeah.
That's one.
Yeah.
Two is joint pains. So
Okay.
a lot of Indian people think that they just have arthritis at 35.
Yeah. 100%. I question myself and I train every day and I'm like, oh, this neck and shoulder are like,
Oh,
no,
no.
no, it's
It's
not.
perimenopause.
Okay.
Joint. So anytime you think you have your creaky knees or your like a wrinkly elbow or like that nagging shoulder,
Yeah.
perimenopause.
Okay.
And that's two. Three is weight changes. So a
Right.
lot of South Asian women, their bodies will not change weight much. Like
Okay.
they'll still be like 150 pounds or
Okay.
160 pounds,
Yeah.
but their shape changes.
Oh, so the composition of the body is
Yes.
turning.
So
Okay.
that's goes back to the insulin resistance things. Our genes are set up for be wanting us to become insulin resistant if
Yeah.
things change. And what's a bigger change than perimenopause? And so then the body goes, I don't have estrogen as much anymore. I'm
Mhm.
going to shift muscle composition. I'm going to shift fat composition and move it here to the
Okay.
midsection. And
100%.
so a lot of South Asian women's bodies shift and they're like, I used to be able to wear, I'm the same weight,
Yeah.
maybe 10 pounds different, but I can't wear the same clothes I used to wear
Yeah.
because my body shape has changed.
Yeah.
That is perimenopause. So
Okay.
that's not you being like, oh, my diet must have changed, or maybe like I'm not going for as much exercise as before. You could have the identical diet, identical exercise and activity regime, and
Yeah.
your body can still change because you've lost the one muscle or are in the process of losing the one muscle that maintains your lean muscle mass.
Yeah.
And that on top of genes
Yeah.
that already are susceptible for insulin resistance, diabetes,
Yeah.
heart disease, heart attack, stroke, fatty liver,
Yeah.
uh, on top of that, turns that on. And then those conditions
Um,
start to increase. Fatty liver is huge in the Indian
yeah.
community.
The metabolic diseases just kill us. Like they literally everybody has something.
I
Yeah.
know.
Yeah.
And that if we allow for women in their 40s who are South Asian to
Yeah.
go unchecked in this,
Yeah.
then that's when we see the 60-year-olds. So we're
Yeah.
not seeing heart attacks and strokes in women in their 40s,
Yeah.
but we're seeing them in the women in their 60s,
Yeah.
which could have been prevented completely
Yeah.
by identifying that this was a problem in their 40s and then doing something about it. And that means taking hormones. The
That's
only way we know to make any difference is take hormones. The
Okay.
risks that we used to talk all about
Yeah.
aren't really real. They
Okay.
are old studies that 25 years ago didn't really look at the right things. And that's why we're having a shift now, because in the last couple of years, mainstream medicine has identified, oh, we were totally wrong.
Can you
What
give us a quick recap of what this stuff is that has ruined it for all women, for like my mom's age? Like there's a whole group of women that are in their 60s and 70s now that might have actually missed that window of being able to have HRT. And it's a discussion that needs to be had. So what is the science that was not correct? And what is the science now leading us to? And when does a woman even know that she's ready for HRT? And when is it too late to start HRT? Let's have that HRT discussion. Yeah.
So 25 years ago, before that, 70 to 90% of women were taking HRT in their 40s or 50s.
Okay.
So the vast majority of women who were in
Yes.
menopause were taking hormones.
Okay.
The question was, we should do a study
Yeah.
to show how good it is.
Okay.
And so then the largest study ever done
Okay.
in a randomized control trial, meaning they had one group that was taking it, one group that wasn't taking it,
Yeah.
had to be stopped 2 years into its beginnings. It's supposed to be a 5-year study
Yeah.
and then followed up over the next many decades.
Yeah.
It revealed that two outcomes surprised them.
Okay.
One, women were getting heart attacks and strokes when we thought that hormones were the fountain of youth. They're like, how are you possibly getting heart attacks when this is supposed to protect you from heart attacks? Two, it crossed the safety threshold for breast cancer. So the number of women that they said was acceptable, because we knew hormones cause breast cancer. Like at the time, like estrogen causes breast cancer. It's the risk. That's why every time we're looking at estrogen in your life, like when did you have your baby? How young were you? Did you breastfeed?
Yeah.
How old were you at puberty? When did you go through menopause? All of those are trying to capture how much estrogen you had exposed in your life to know how
Okay.
much risk of breast cancer you have. So
Oh,
like we know that estrogen plays a role there,
yeah.
but it crossed a threshold.
Okay.
What they had to study, however, and this was the limit of what we do in medicine, you only study the population that gets the disease. So you don't study 30-year-olds for colon cancer, and you don't study 20-year-olds for diabetes. You don't study 30-year-olds for dementia.
Mhm.
The people who get heart attacks and strokes are in their 60s and 70s.
Exactly.
People who
Okay.
get breast cancer are in their 60s and 70s and 80s.
Yeah.
So what they did is they then said, who gets these diseases? So they gave hormones to women in their 70s and in their 60s.
Oh,
The average age of the woman was 63. Of
yes. And those were the women that were getting the heart attacks and the cancer in this study.
course they were. Of course they were.
Okay.
Half of them were morbidly obese
Okay.
because this was done in the 90s
Yeah.
when the population of America, as a cross-section of society, obesity was massive. So
Yeah.
half of them were obese.
Okay.
And so already had risks for breast cancer as a result of that, already had risks for heart attacks and strokes as a result of that. And then the age was the
Yeah.
age much older than the population that we typically give hormones to.
Right.
And then they proved an already foregone conclusion. They're like, oh, look, breast cancer happens when we give hormones to this population, and heart disease happens. Of course it does. You gave 70-year-olds
Yeah.
hormones who haven't had it in their bodies for 15, 20 years.
Well,
So a diseased, aging body is now being given something that it hasn't even understood what it is for 2 decades.
yeah.
And half of them were smokers. So
Oh,
then on top of that, it was the
mhm.
90s. It was the 90s.
Yes. And it was
Half of
smoking.
them what did we think was going to happen?
Yeah.
And over the course of the many next years,
Yeah.
doctors started, and this is when I was in school. So doctors started teasing apart, like, this makes no sense. Like everybody was doing okay in their 40s and 50s on hormones before. We ripped apart those studies, but the damage was done.
Yeah.
The studies themselves made news. Breast cancer is caused by hormones. Stop eating soy. Stop eating flax seeds. Estrogen was the devil. Devil, 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 devil.
Yes.
Our diets changed. Stop touching receipts. There's estrogen on receipts.
Yeah. Been
Have
villainized. Yeah.
in the 2000s, everything that had anything to do with estrogen was
Yeah.
don't touch it, don't go near it, it's going to kill you.
I
All
think
because of
every South Asian was trying to, and especially vegetarians were trying to get their protein out of soy. And it was like, no, you're going to get man boobs if you're a male, and you're going to get breast cancer if you're a female. don't
And
touch
the
it.
exact opposite is true.
Okay.
You prevent breast cancer with soy. You prevent
Wow.
breast cancer.
Okay.
You prevent disease. You prevent osteoporosis. You prevent it. Asians, Vietnamese, Chinese people were like, wait, what?
Yeah.
What
Yeah, of course.
are you
They
talking
that's
about?
the main part of their diets. And
But unfortunately, this innocent bystander got swept up in the misogyny of estrogen villainy,
okay.
and we went with it. And then that number, that 90% of women who were taking hormones before, went down to 4%.
Oh,
In
wow.
the following 10 years, heart disease skyrockets,
Yeah.
strokes skyrocket, osteoporosis skyrockets, colon cancer skyrockets. And they realized, like, remember during COVID, I mean, it still is, but like
Yeah.
how we would tell that how many people were actually dying of COVID uh, versus the numbers
Yeah.
of people who had tested positive was the death rate every month that we had now that was higher than what we had before COVID. They're like, oh, actually, we think that it's 30,000 people a month, not 5,000 people a month, because we have that many more people dying
Yeah.
than we normally have. So
Mhm.
we saw that the number of women dying over the next 10 years in America alone was an additional 100,000 women. That there were like another 100,000 women died than they did the decade before. That was unusual. What changed? We took hormones away. We
Okay.
took hormones away. So more people were dying as a result of that. But
Okay.
then Europe, France specifically, who was like, sorry, we don't see what you're seeing. Our studies are showing the opposite of what you're seeing. Giving hormones prevents breast cancer. Giving hormones prevents dementia. Giving hormones prevents diabetes. It prevents colon cancer. They're like,
Yeah.
what? Your study was very flawed. But
Hmm.
America didn't hear the message, and therefore neither did Canada. Europe was like, we're going to keep going in the right direction.
Interesting.
And
Okay.
so they did. And so the French specifically were like, and the Germans, they were like, you guys are unhinged.
Okay.
Where you're going with this. We're going to keep giving hormones, and their populations have been benefiting from that mentality, that a non-diseased shift in culture around the idea that estrogen is bad and progesterone is bad. And they've benefited from that because they were also using different hormones.
Mm.
North America was prone to using hormones that are made from horse's pee. And those hormones cause other bad things to happen in our bodies when we use them.
Okay.
Whereas Europe was using what now we call bioidentical hormones, but just basically hormones that aren't made from horse's pee.
Okay.
And those hormones come from Mexican wild yams.
Okay.
We call those bioidentical, we call those like biosimilar, we call those body identical, like all kinds of different names.
Okay.
Nobody uses the synthetic stuff anymore. Like nobody really uses this,
Okay. That's
no
good to
matter if you see a gynecologist, if you see your GP, we
yeah.
all use the same bioidentical hormones,
Okay.
which just means these hormones look very close to what our bodies look like. So maybe our body will accept them better.
Yeah.
And in accepting them better, maybe it won't have negative outcomes. And so
Mhm.
we see that too. We don't cause the same risks, even the small risks that were associated with the synthetic versions, we don't see anymore. And so
Okay.
now that plus estrogen we know prevents disease, and we know progesterone helps on a day-to-day basis for symptoms, have all led to this massive tsunami
Yeah.
of women online like you
Yeah.
being like, my experience is different.
Yeah.
The things I'm reading are different. The evidence is different. I need to talk to my doctor about it.
Yeah.
But your doctor, like most doctors, unfortunately, don't learn about it.
Okay.
They don't go to conferences. They never learned about this in school. How
Mhm.
could they? All they learned in school in the early 2000s and in the 2010 to last year was hormones are bad.
It's bad. Yeah.
So why would they not? Why would they have any difference? And
Yeah.
they were already traumatized by giving hormones in the 90s to women, and then they were told, you caused breast cancer in Betty.
Yeah.
You caused the stroke in Sarah.
Yeah.
And how could they not get that out of their heads? So that's led to this like really stubborn like culture in medicine that doesn't want to give hormones on top of sexism. So
Yes.
all of that on top of racism.
Yes. Exactly. Yeah.
All of that together,
Yeah.
of course your doctor's not going to be with it with this kind of stuff.
No.
Enter people like me who are like, no, no, we've known this for a long time and we've been pushing, pushing, pushing. Thank
Mhm.
God now finally it's snowballing.
Yeah.
And and that's why I do things like this, because it's not fair. It's so not fair for these women to not be treated or not be at least told the truth so that they can make the decision that they will literally game change the rest of their life.
I think a paradigm shift has to take place around estrogen. because when you speak about, hormones and HRT, I think the biggest obstacle there is, well, estrogen's not good for me, so I don't want it. Women get breast cancer and right away they're told, like, cut out the estrogen in your body. And I mean, they're two different things, but you're saying that estrogen is actually helping to prevent disease and will help us not have this 20 years or 15 years of menopause where we feel like complete crap, like where our
Yeah.
bodies are out of our control and our minds are out of our control. And something as simple as HRT could help us.
Could, will, like
And
will.
it
It's
will.
not a could, it
Okay.
will.
Okay.
There are almost, it's hard to find the woman
Yeah.
who it won't help. It's hard to find the woman who we can't give it to. There are
Unreal.
exceptions. If you had breast cancer,
Yeah.
we can't give you hormones.
Okay.
And also, everybody thinks that everybody's going to get breast cancer. That's also very strange. The
Yeah.
rate, the rates of breast cancer are tiny.
Compared
And
to what? Like heart disease. Well, if you compared
compared
the
to everything, compared to everything.
oh, wow. Okay. It seems like breast cancer is always the number one concern.
Yeah,
No.
why? Why?
Yeah.
Where did that come from? Where did that come from that all of a sudden breast cancer was the thing that we all had to worry about for
Yeah.
every woman in our practices, every woman in it's so beyond me that the rate of breast cancer incidence in the worst study that ever happened in the late 90s, the Women's
Yeah.
Health Initiative is called.
Yeah.
The rate of breast cancer in the group that was given horse pea hormones
Yes.
was 6 in 10,000.
Oh, wow. Okay. That's pretty low. I mean,
Do you
that's
know that the risk of breast cancer from what do you think is worse for breast cancer? Smoking or drinking?
I would say drinking.
So a bottle of wine a week
Yeah.
has a way higher risk of breast cancer than
Okay.
almost any other thing you could possibly do in your life.
Yeah.
It's equivalent to smoking 80 cigarettes a week.
I need all my sisters to hear this because as a South Asian culture, I mean, our culture is kind of built around making drinking a very social a thing. And it's no one even bats an eyelash if, they're having a glass of wine a couple of nights a week. But I said alcohol because I, myself stopped drinking many years ago after I realized like not just the brain damage it does, but your liver and all the other organs, like alcohol is really, really bad for you. So could that be one of the things like lifestyle that leads South Asian people to be more susceptible to all of these metabolic diseases?
Really, it's sugar from the alcohol, it's the
Yeah.
liver damage from the alcohol, it's the inflammation, it's the carcinogenic.
Yeah.
Alcohol is a carcinogen. It's literally a carcinogen.
Yeah.
So we pretend
Yeah.
that it doesn't do anything to us
Yeah.
because like we're ostriches, right? Like we're like, don't take that away from me because I want like, are you gonna just take all the joy out of my life? It's
Yeah.
like if you can drink,
Yeah.
you can absolutely drink, enjoy your alcohol, enjoy your wine. I do.
Yeah.
However, we can't pretend that alcohol here is totally safe and fine when it's literally the greatest factor that we can have to increase our breast cancer rates
Right.
of a disease that isn't really that prevalent in society. It's a very low risk condition,
Yeah.
not on its own and compared to everything else. And if that doesn't, we're not supposed to minimize breast cancer. You're still supposed to get your mammograms. We have to check because it exists. It happens.
Yeah.
It happens for every 10,000 women who go through mammogram screenings.
Yeah.
7,000 will be called back because they find something in their breast that looks weird.
Yeah.
Of those women, less than one will get breast cancer.
Yeah.
Like
Okay. Oh,
we
wow.
need
Wow.
to,
Out of 7,000, one will actually have something actually real going on. Oh,
yeah,
I had that scare. I had my first mammogram at like 41, I think, and I had the same scare. And every 6 months they want to, and it literally does. It scares you because you don't know what it is, but it's very normal to have cysts and all these things developing, especially in menopause.
breasts are dynamic tissue. They
Yeah.
literally turn into a different being when you have a baby, and
Yeah.
then turn into another being when you're breastfeeding, and then turn to another being when you're going through PMS, when you're going to like another being when you're in your 40s. Like breasts are extremely dynamic tissue. That's what they are. And so when you're X-raying, like a mammogram does, which we 100% need yearly or every 2 years screening from 40 and onwards, right? Like extremely important,
Okay.
especially for South Asian people, and I'll say why in a second. Um, we need to screen for this condition, because when it does happen to a woman, even if she is that one woman in 10,000,
Yeah.
and if the overall risk is 2%-ish, 2.5% in a lifetime, uh, like absolute risk of getting breast cancer, then we have to protect her. We have to find her too. We have to screen for her. It's a very important. But let's not kid ourselves into thinking that estrogen, when you give it to somebody externally, is going to cause this disease just because we attached estrogen to breast cancer and we
Yeah.
block it at every given corner to
Yeah.
not affect us anymore. They're two totally different things. Giving
Right.
estrogen to a woman in perimenopause and menopause does not cause breast cancer. In fact, it prevents it.
Interesting.
It
Yeah.
prevents it.
Yeah.
The women who are on hormone replacement therapy, estrogen included,
Mhm.
and they happen to get breast cancer,
Yeah.
they over survive the women who weren't taking hormones
Oh,
and had
wow.
breast cancer.
Yeah. And
The
that's
reason,
probably because their overall health is just better in
yes,
a
yes,
place.
yes, 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 yes.
Yeah.
And because estrogen prevents breast cancer.
Right.
Estrogen in our life, cumulative exposure of estrogen, when I
Mhm.
said earlier,
Yeah.
when over time increases breast cancer risks, right? That's why we look for it. We're like, when did you get your period? All of that stuff.
Yeah.
That is a completely different thing than giving a woman who's losing estrogen in perimenopause and menopause
Yeah.
some estrogen, a little bit of estrogen
Yeah.
to help her be healthier. Those
Yeah.
are two totally different things, but somehow we combined them. We just said estrogen bad, bad, red flag, red flag, red flag. It's a green flag. Then
Mhm.
they're two totally different things. And even then, like when we're talking about breast health,
Yeah.
like mammograms are important. They identify a lot of things.
Yeah.
And so what we should be talking to women who are getting mammograms and saying is, you're going to probably be called back.
Yeah.
Not see you in 2 years. It's
Mm.
70% of women are called back for an ultrasound,
Yeah.
another mammogram, a diagnostic mammogram, an MRI. 70% of women who get a mammogram will be called back
Okay.
because breast density is high in women in their 40s.
Yeah.
And you can't see a tumor that looks like a cloud
Yeah.
when breast density looks like a cloud.
Right.
If a cloud is covering a cloud, how are you supposed to see the cloud?
Yeah.
That
So
is
that's why
that.
they call you back for
They call you
ultrasound.
back.
Yeah. Okay.
So we should always be telling women who are getting mammograms, you're probably going to be called back.
Yeah.
It's
And
gonna,
that's normal.
it's
Okay.
going to be nothing.
Yeah.
The times it's not nothing is one time out of maybe 10,000.
Okay.
So
We,
like we shouldn't have this fear of mammograms and the callback. We should be like, the expectation is that I'll be
I'm
called
gonna,
back,
okay.
but we don't do that.
No.
We freak out,
Yeah.
we panic, and
Yeah.
then we attach more importance to breast cancer because, oh my God, I went through a scare.
Yes.
And I remember my girlfriend who had breast cancer, and thank God they caught it. Of course, thank God they caught it. But
Yes.
that is not the norm. We need to not do that to each other. We
Yeah.
need to we have to tell the truth.
Yeah. Yeah. No, I have like hundreds of women just on my platform when I started speaking about HRT, and across the board, it was like it saved my life. It gave me my life back. And these are like, some of the fittest women that I also know in their 40s that are still like that still look absolutely amazing with the abs and everything. And I've reached out to them to just ask, like, how did you get through menopause? Because it started happening to me. My diet doesn't change. I work out the same every day. I eat clean. I don't do binging or anything like that. But that weight did start to pack on in that midsection. I was like,
Yeah.
ooh, nothing's changed. Like something's going on. And I'm just that in tune with my body. Most people are not, right? So when I reach out to these women that are super, super fit in their 40s and they're like, oh yeah, HRT, that saved my life. Like I've been on it for years. And I think more women that are on it, we need to reach down to our like younger sisters, to our cousins, and just let them know like, yeah, I am on it. So I think just taking that villainizing estrogen and talking about it and saying, no, 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 estrogen is not bad. It's actually good for you. Like you need to be on whatever hormones you need through menopause. So when would a woman start HRT? And also, like, I'm thinking of my 65-year-old mom that's been through it and she's got osteoporosis. And like, I want to talk to you about bones later as well, because I've been diagnosed with osteopenia and I weight lift quite a bit. All of these things. So how far, um, say like somebody's been in menopause for 10 years already, can you still like, could we get our moms that have missed this whole estrogen is bad? Could we get them on hormones now? No, we've missed it for them.
Yeah, if we try to put these 60-year-olds on hormones now, and what a missed window of opportunity because of that one really stupid study
Yeah, yeah,
that took away so much that could have changed these women's lives,
yeah.
that because of that, we would essentially be replicating the study. So
Yes,
if we put women in their 60s and 70s on hormones now,
yeah,
we would essentially be going back to that study
yeah.
and now causing heart disease.
Okay.
And the reason we do that and causing other cell changes to happen because this aging body is no longer receptive, is no longer sensitive to the positive changes of hormones. It's now making that addition of hormones
Hmm.
make aging cells more likely to turn on bad genes,
Okay.
more likely to clot,
Yeah.
more likely to cause mutations.
Okay.
And so we don't do that because otherwise we would just be going backwards and making the same mistake we did before. And so anytime a woman who's 10 years past menopause or 10 years past her last menstrual period in her 60s will say, listen, we don't really know what the risks are, but if we go back 25 years, the risks look like we caused dementia, we
Yeah.
caused heart disease
Yeah.
in these women. And because we don't, those are unknowns, I don't think it's a good idea. But if you are not sleeping,
Mm-hmm.
if you're sleeping 3 hours a night and if that's going to kill you,
Yeah.
if that's causing you to be insulin resistant diabetic or even like obese
Yeah.
by our standards, if that's going to give you a heart attack, if your anxiety is really bad and no treatment, no medication, no meditation is
Yeah.
helping you,
Yeah.
and you want to see what a short period of time of taking hormones might mean to see if they're connected to that.
Yeah.
So I'll give this as an option to women. I'll be like, you're 62 years old. That's not fair for me to tell you that you can't take this. Do
Yeah.
you want to know what it's like and understand that there's unknown risks here?
Yeah.
If she says to me, yes, I want to know if my sleep that I've taken everything for is menopause related, and I
Mhm.
give her progesterone to help her sleep, and she says, I sleep 8 hours a night,
Yeah.
then I'll say, what does that mean to you?
Yeah.
Do you want to keep taking this, knowing that there's this sort of like black hole over here that we're not super sure about? And the vast majority of time after that conversation, they'll be like, don't take my sleep away from me. It's
Yeah.
everything.
It's so important because just to regenerate your body at night, like if you're not sleeping, you're actually slowly stepping towards disease anyways.
Insomnia is like a torture device.
Yeah.
So why would we do that to ourselves if we had an option? So I am not like a gatekeeper to medicine.
Mhm.
I'm like, do you want to do this? Okay. And we do that all the time. We do that for everything in medicine.
Yeah.
There are risks for this drug.
Yeah.
And doctors will say, would you like to take the risks of taking this drug?
Yeah.
The cholesterol medication might give you back pain. Do you want to take that risk? The biologic agent for your Crohn's disease might make you have cancer of some other kind later on in life
Yeah.
and might give you constant infections. It
Mhm.
may make you susceptible to COVID and that might kill you.
Okay.
Do you want to do that? And we're like, weigh the risks and the benefits.
Mhm.
And yet we somehow don't do that for women in menopause. We
Yeah.
don't tell them this. We
Yeah.
do it for every other condition,
Yeah.
everything else. And yet we don't do it for this population. Why? Why don't we do that?
It's just because it's villainized already, I think, and it's already been like bold letters stated. It's not good. We're not going to have this discussion, and
Yeah.
that's really sad. Yeah.
And nobody asks the questions. Like nobody's asking the question in like regular doctor circles, my colleagues, my friends, they're just like, I've been the words like criminal, well,
Yeah.
like you're gonna kill my patient,
Yeah.
because I've been doing this for so long.
Yeah.
Those kinds of words have been used in my direction by my friends.
Yeah, but I'm sure your patients have other things to say about you, like you probably saved their life and gave them their life back.
Oh, I don't care about people who
Exactly.
are
Yeah.
ignorant
Yeah.
or who don't understand things. I was like, go, you can learn on your own.
Yeah. I'm
Go and have the
helping.
conversation. And if you don't,
Yeah.
you're the one who's actually doing something
Yeah.
that would
It's so
I
true.
would consider malpractice.
Yeah. So we talked about 10 years. What about women when they're starting? Like, can you start or should you start HRT in perimenopause? Like when is going on, that crazy time in our life?
Yeah, so doctors now have a lot of doctors have now accepted that okay, we can use HRT in menopause.
Okay.
The rate currently still is only 4% of women who are on HRT who are in menopause. It's still only 4%. Okay, so because we
Wow.
went from 4 to 1, and
Yeah.
then now climbing back up a little bit,
Yeah.
it should be
It
99%.
should be. Yeah. It should be how it was before. Yeah. Yeah.
So the doctors now have like gone towards, okay, cool. Menopause hormones are okay. We have lots of options. We're learning about it.
Yeah.
Influencers are talking about it. The tide is changing. Oops, we
Yeah.
were wrong. We
Yeah.
get it. But
Okay.
they have yet to go into perimenopause because a lot of doctors, one, don't believe perimenopause exists.
Yeah.
A lot of doctors don't believe that perimenopause is a time that you could do anything because it's like it's a fluctuating time.
Mhm.
So who are you treating? The person who's high in their hormones in March and then or low in their hormones in June?
Yeah. Because there really is no test to test for perimenopause either, is there?
No, the test is you. You're the test. You
Yeah.
tell you tell me, do you feel different than you did before? Do you have any of these symptoms? Do you have the joint pains? Do you have the brain fog? Do you have forgetfulness? Do you have hot flashes? Do you have night sweats? Do you have weight gain? Do you have um, insomnia? Do you have anxiety? Do you have all of those things that we know are connected?
Yeah.
And and do you want to see whether or not this helps you? If you do want to see it, I will give it to you.
Yeah.
You're way more likely to get access to HRT and perimenopause by a provider like myself, like a naturopathic doctor, because medical doctors aren't there yet. Like they just, and I don't think they'll be there yet for a long time.
Yeah, not
So
in my lifetime. Like I'm going to be in this menopause in the next 10 years. So I think women my age, unless we proactively seek out help outside of our GP, I don't think we'll be given access to it or even told that it's an option to help with the symptoms.
there's something interesting happening though. A lot of GPs are going private.
Okay.
Uh, a lot of GPs are going private. They're
In
doing like
like in Canada?
cosmetic in BC.
Oh, okay. Yes.
My friends are going private and
Okay.
they're opening private clinics,
Okay.
longevity clinics, and
Yes.
anti-aging clinics,
Mhm.
and like cosmetic clinics.
Yeah.
And that world is now educating them that if you actually want to help prevent diseases, you put women on HRT.
Mhm.
And um, and so a lot of private doctors are getting access to this information and learning it. So a lot of these private GPs are doing that now.
Ah,
It's just public doctors
yeah.
have to answer to their colleagues,
Yeah.
have to answer to the people who read their charts, have to answer to the guidelines, have to answer to liability, all of those things, right? So they also work in a system that is constraining them from
It is.
being able to actually like break through and be like an individual provider, like it's not just their fault. It's like the fault of the system that was created. It's a fault of all.
Itself. Yeah. That
Yeah,
paradigm shift really does have to take place around
it really does.
estrogen and just de-villainizing it. So if I wanted to say start HRT to, like you said, try it to see if my symptoms go away from it, how long of a period would you put somebody on HRT? Like, do I need to be on it for 6 months to see a difference, or how soon would I see a difference in my life, in my body?
It depends because some women are really sensitive to hormones, so you might start them off on very low dosages. If a woman says, Um, PMS is terrible for me. When my hormones change, my body goes through a lot of shifts, and I hate that. We'll be like, we're going to start you on a lower dose than normal
Okay.
because what if you have extreme breast tenderness as a
Yeah.
result of me giving you estrogen that's maybe too much for you?
Okay.
So it depends on sort of like if you're in perimenopause, if you're 44 years old or 42 years old, and you
Yeah.
think that's what's happening, we usually start lower.
Okay.
And then it takes like 6 months to get you up to like a therapeutic dose, like a regular dose. Maybe you never need that. Maybe you stay on the low dose because you're like, oh my God, that did it. This is amazing. I feel so great.
Okay.
So we usually allow for 3 months in menopause
Okay.
to see the real you who shows up.
Yeah.
And we give about 6 months in perimenopause because you're changing all the time.
Yes.
And
Yeah.
so some months you might be like, oh, this doesn't feel okay. Like, okay, we have
Okay.
to dial it back. And some months we have to dial it up because of the dynamicness of your hormones in that time. But we usually get there.
Okay.
We usually get there. So a little bit longer in perimenopause, way shorter in menopause because in menopause you have no
You
hormones.
have nothing. Yeah.
They're just like giving something you didn't have, and so then you get to be like, oh, thank God. And it's
Okay.
usually very, very fast.
So I have a question. Now, for centuries before HRT was probably available, we'll talk about like, supplemental remedies later, but is this a natural, like there are people that do say, well, this is a natural process of aging for women. Like they have to go through this, it's just meant to be. What would you say to that? Like that this is a natural process that we just have to go through.
This is really interesting because I am a man,
Yeah,
and there's a movement in like feminist forward medicine, which I believe I'm part of,
yeah.
uh, but by female doctors
Mhm.
who don't want, and women in general who don't want to diseaseify menopause,
Yeah,
where like there's a natural occurrence, like we shouldn't call it a disease, we shouldn't call it um, like we shouldn't label it a bad thing.
yeah.
And I have a really hard time with that because you don't have to call menopause a disease, but
Okay.
you can call everything that comes with it a disease
Yeah,
or a risk factor for disease.
yeah,
So menopause doesn't have to be the disease, but the 10 conditions that occur as a result of losing those hormones,
yeah.
those are diseases.
Other diseases.
Those are risks for diseases. So I feel like we should need to stop like preventing ourselves from using the treatment,
Yeah,
or call it what you like. Don't call it treatment.
yeah,
Don't call it hormone replacement therapy.
yeah,
Don't call it menopause hormone therapy.
yeah,
Don't call it whatever you think adds to the social um demonizing of menopause as a natural thing. I understand that,
yeah.
but don't allow for that to then put a cloud or a shadow on the therapy that saves lives.
Yes.
I have been wearing contact lenses
Yeah.
for 30 years.
Okay.
I was in fourth grade, and my teacher said either Bobby's becoming stupid
Yeah.
or he can't see the board.
Yeah.
And so,
Okay.
was that my fault?
Yeah. No.
Was that a natural occurrence that happened in my body that a lot of people stopped seeing as well as they did before? Should I not wear contact lenses?
Yeah, there's a tool there. Yes,
Should I
exactly.
not wear glasses?
Yeah.
It's a natural occurrence. Should I just not do anything about the fact that and just live my life
Yeah.
literally blind?
It's true. That's a good way to put it and a good way to look at it, that there is that tool is there. So why would we not like use the crutch or use the glasses to help us through these years and to prevent those other diseases?
Yeah, I don't understand that. So I understand the like worry
Yeah.
of like we shouldn't call, there's a group of doctors who are pushing back
Oh,
hard on this and saying stop,
okay.
saying that this is a time that we should be screening women and investigating women and blah blah blah. It's like,
Mm.
are you out to lunch?
Yeah.
Like you, I get what you're doing, that you don't want to attach those two things and call this a disease,
Hmm.
but then you're completely ignoring what actually happens in
As
reality.
a result. Yeah.
You're ignoring it completely.
Yeah. Okay. I get that. So what do you think about the natural supplements? Like in Ayurveda, there's,
Mm.
lots of herbs. There's a lot of natural supplements even on the market here in BC and in Canada that say they'll stop, like eliminate hot flashes and, help balance your hormones. I don't
Yeah,
know exactly if there's studies to, go
there's
behind those
definitely
claims, or how much does that help?
there's definitely studies on non-hormones, hormonal therapy that show that you can get symptom improvement.
Okay.
So a woman could, like, we know this through people with breast cancer, right? Like we can't give them hormones.
Right.
And so if um we need something for them, we give them these other things. And they're like, oh, my health is so much better, my sleep is so much better, all of that kind of stuff. So we definitely know that there's a lot of truth. And I'm a naturopathic doctor, so I
Yes,
use these all the time. They
of course.
work, they
Yeah.
work, they work.
Yeah.
We don't have any evidence that they prevent disease.
Ah,
Like
okay.
just because you don't have a hot flash anymore because you took black cohosh or red
Yeah.
clover
Yeah.
doesn't mean we know anything about whether or not that prevented you from having dementia.
Okay.
We don't know whether or not that prevented you from having osteoporosis.
Yeah.
We don't know whether or not that translates into you not having a stroke.
Yeah. Okay. So I want to go back. You just said osteoporosis. Like what actually happens to our bones during this period? Because it is such a hard reality when I look around, especially at the aging South Asian community, of watching our elders in their last 10 years of life not even be able to get out of their bed or their chair. Uh,
No.
my grandmother included. Now, my mom has osteoporosis. And like I said, I had this DEXA scan done when I was in India. And
Mm,
just to be like with my mom, because I wanted to see how bad hers was foregone. And never in a million years, I've been like weightlifting for 15 years. I eat right, like the protein's in there. Did I think that I would get this? You're at a risk for osteoporosis. And I'm like right in there. And
mm.
they said that I have osteopenia. So I'm like, so what actually is happening? Why are our bones just becoming so frail? And how much does that have to do with menopause?
It has a lot to do with menopause. It has a lot to do with loss of estrogen, loss of progesterone. Those are extremely important. That's why hormone replacement therapy reduces fracture risk and reduces osteoporosis. We
Yeah.
can't use it as a treatment for it when it's already there, but we can use it as a prevention,
Yeah.
um, which is why it's so important to have this conversation about getting started earlier.
Or yeah.
Osteopenia is rampant, right? Like, so like those scores
Yeah.
are comparing you to a 20-year-old.
Yeah. Yeah.
And so it's almost not fair
Yeah.
to compare us to the 20-year-old version of ourselves and not expect that there goes going to be some shift downwards as we age.
Yeah.
Also, this is almost a natural occurrence.
Mm.
Whether you weight lift, whether you do all of these things, you're doing things that prevent it from being worse.
Yeah.
So the genetics, the inflammation, the things that were inputs in your early life that would have led to the buildup of all of this,
Yeah.
all of what you've done now and keep doing are preventing you from being a worse version of yourself that way.
Yeah.
And that's it. All you need to do is be continuously eating an anti-inflammatory diet. Osteoporosis is an inflammatory condition.
Yeah.
You need to be active. You need to be lifting heavy and
Yes.
creating a shear force on your bones. You need to be taking estrogen. You need to be taking progesterone,
Yeah.
and all of those things are the right things. Don't be too attached to that page
Yeah.
because it may never shift,
Hmm.
but it may never translate into you ever having a fracture, which is what
Yeah.
matters.
Yeah.
But you might have osteopenia for the next 40 years.
Yeah. Yeah. It might be just
But
where I sit for the rest of my life. Yeah.
yeah. And
Yeah.
so like you're doing all the right things. And
Yeah.
so stay strong, really.
Yeah.
I
Yeah.
think I think the reason our moms are unfortunately not in this situation is because they never knew any of this kind of stuff. Like they were um, the result of the kinds of diets we've had for so long. They're the result of the kinds of stresses we've had for so long. They're the result of depression. Like depression is enormous in our world, and that influences every move we make on a day-to-day basis.
Yeah.
And and that I think is a very different thing than what you're talking about with you, what you're doing.
Yeah.
You're not going to have the same outcome
Yeah.
at all.
Yeah, no, just based on what's happened
Yeah.
previously in the females in my generations was one of the biggest factors that I've been training for as long as I have. Because I'm like, nope, not me. Like, I'm not going to be bedridden for 10 years of my life before, in your 80s and 70s even. So,
And
yeah,
that's one of the reasons why even like I speak about these things. I just did a this exact thing, but for a
right?
group of Black women on Saturday.
Yeah,
Um, just nobody talks about these kinds of things, and like you then witness what happens to your own mother, and then all of my aunties and everybody, and you're just like, hello,
yeah.
like
The cycle
we
has to be broken. It's going to happen with us. It has to happen with this generation. I'm not letting
wake
this
up,
happen.
like come on. So,
Yeah, no, I'm going to
and
try
it's not
as
their
hard as,
fault.
no, it's
It's
not.
not their fault. Nobody told them.
100.
Nobody made this a priority. Nobody made them a priority.
And it's sad that we can't, now that we know and we're aware that this HRT would have helped them so much, but they're past that point. So it's hard. It's hard to know that they were failed by the system and that they have to suffer now, right? So
Yeah, it's the reason why I do what I do. It's not
yeah,
fair. It is
no,
it's totally not fair,
yeah,
and we have to correct it. Otherwise, what was the point?
yeah, yeah, no, it's hard. So going forward, I mean, I'm just going to continue to spread the word. A lot of my followers were really shocked when I shared that this osteopenia. So I will go back to them with like, okay, this is where I could be forever. And if I hadn't been working out for the last 15 years, it would have been a lot worse because that's where
Definitely,
genetics are leading me. Obviously, this is genetic because
definitely.
it's nothing that I'm doing in my day to day causing this. Like Yeah. So
All of this means like, to me, it's like we know this kind of information. Medicine should be telling women, oh, you're 35 years old. Why don't we see what your bones look like now?
yeah.
We we already know that it's downhill. Why
Mm,
do we wait till 50? Why do we
yeah.
do that? Why do we
Yeah.
do that?
No, because we need to work more on preventative, and I don't think
Yeah.
anything in this country or in medicine in general is preventative. It's treating diseases with medications
Yeah.
and
And so if that's the case, then maybe we need to be a little bit more self-proactive and advocates for, you know what? I'm gonna go pay the $200 for this. I'm gonna see what it's like. We put so much authority and so much godly trust in the medical
I
system that is
know.
also a massive downfall of our world.
Yeah.
That for some reason we decided that every child of ours needs to be a surgeon.
Yeah. Yeah.
And because of that, we revere
Yeah.
our doctors to the point that it is to our detriment
Yeah.
because they're people too.
Yeah.
They have the same biases, the same blind spots, the same everything. They're people too.
Yeah.
So like, what do you think is going to happen?
Yeah.
Like, like we have to stop that.
Yeah. No, I'm a sports nutritionist first, and I
Uh,
many doctors that are my clients. And it's because they're like, we didn't learn anything about nutrition. And that's where that opened up for me was like people are going to the doctor and the doctor will recommend like, oh, eat like this or eat like this, but they actually really don't know. They're still going by Health Canada's food guidelines, which are telling you to eat cereal, like Cheerios for breakfast. Like that pyramid is just needs to be thrown out as well. Like this is a
Yeah, but
whole
like, but
discussion.
we all know something's off.
Yeah.
Like we all know something's off. Like
Yeah.
it's not
Yeah.
like we
No.
can smell the smoke.
Yeah.
Like you know what I mean? Like,
The doctor says I'm fine. I don't need blood work. So I think we do need to, as a community, just push for it, advocate for ourselves. It's not coming out of the doctor's paycheck. So if you haven't had blood work in the last year and you feel like something is off, just like what would a person do? Just say, no, I actually do want to get this blood work because something is not right. Or
yes, I'm so tired
yeah,
of people trying to convince their doctors of doing right
yeah,
by them
yeah,
that I'm just like, can you pay for it?
yeah,
Can you
exactly. Yeah,
if you want to do a screening blood test that covers everything that we know an Indian or South Asian woman needs to know, her
yeah,
insulin levels, her sugars, her cholesterol,
yeah.
her inflammation, all of these things, it's $150.
Oh,
It's
wow. Yeah.
to do everything you could possibly measure in a person is $150.
Insane. People will
Just
spend that on a night out easily.
just do it.
Go get the blood work done.
Like, oh
Okay.
my
Yeah. So where would I go if I said, you know what, my doctor's just like, he's closed the door on this discussion. I want to go get this blood work done. I'm willing to pay for it. What, like, can we reach out to you, to
Yeah,
naturopaths? Where
you
would
can
we go?
see your local and naturopath. You can
Yeah.
see me. You can see my colleagues. You can see
Yeah.
like we're usually woke to this kind of stuff. It's like who we
Okay.
are, and
Okay.
we are a tiny profession.
Yeah.
Uh, only like 500 and something of us in the province of BC.
Oh, wow.
But like we're pretty mighty with like what we do,
Yeah.
and I think are partially, if not wholly responsible for the shift in hormone replacement therapy being normalized because we've been doing it for decades.
Okay.
We've
Yeah.
said, no, 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 this doesn't make any sense. We've
Yeah.
been doing it for decades because we were able to see what the stupidity was there.
Yeah.
And like compounding pharmacies that make hormones are
Mhm.
basically built by us.
Right now.
We are the clientele.
Yeah.
Medical doctors aren't doing it. So
No.
all of these compounding pharmacies that are making hormones and making a lot of money off of all of it, who
Yes.
are their clients? Us.
Yeah.
So
Okay.
a tiny profession, but we know what we're doing.
Yeah.
And don't let anybody else tell you otherwise. It's just because they don't know what
Yeah.
they're doing.
Yeah. So you can't blame them even for their ignorance because they just
No,
don't know.
they just
So
don't know.
yeah. So reaching out to our naturopath is the first place. If we feel something is off, the blood work will be all done, tested, and then we will know what our risk
Screen,
factors
screen,
are.
screen, screen.
Screen.
Screen for who you are, screen for where you come from, screen for your genetics, screen.
Yeah. And have the discussions, I guess, then following that on where you stand for whether it's therapy like HRT or, something else for managing your insulin, whatever it is.
Absolutely.
Yeah.
Absolutely. And I'm exhausted by the patients who come to me and say like, okay, we also have this as a problem in our world.
Yeah.
Like we are the highest income earning demographic in North America.
Mhm. Yeah,
Like
I saw that. Yeah.
Indian people
In people. Yeah.
out earned everybody hands down. That
Yeah.
doesn't mean all of us are like that, of course
Yeah.
not.
Yeah.
But as an average, and yet when it comes to paying
Yeah.
for our health, for some reason, we're like, I'm just gonna go ask my doctor
Yeah.
because I want it covered.
Yeah.
You already shot yourself in the foot. Sorry.
Yeah. There's
This
nothing, once your
is-
health is gone, it's gone. Like there's nothing else. No amount of money can replace
And I
that.
think it's because we revere these people
Yeah.
and we've put them as gods
Yeah.
and we are like looking for them as the standard bearers of what we should do. And we don't put money to where our health is, even though we are the highest earning group in on the continent.
Yeah.
So whenever an Indian person comes to see me, I'm always prepared for the negotiation. I
Yeah.
always am.
Yeah.
I'm Indian. I am Indian. So
Yeah.
like,
Yeah.
I'm just like, listen, go ask whatever you need to ask. You are
Yeah.
going to have 3 months of a battle,
Yeah.
promise you, and I'll see you in 3 months when you're ready.
Yeah. Yeah. Because at the end of the day, I mean, who knows? Maybe we are in that highest income earning bracket because we are so cheap with so many things. But I mean, you can be cheap with, like, people will not be cheap with their cars. They won't be cheap with their clothes or their handbags. Like they got to play the role. But what's happening inside them, their health and their life, like I'm gonna be cheap with that. It
It's
doesn't.
just a cultural shift we need. And then whenever I bring this up, because I really speak to everybody, they're
Yeah.
always like, how do you think I got all this money?
Exactly. That's what I'm saying. I'm like, maybe that's why we got all this money, because we are so cheap. But I
Yeah.
mean, I don't see people, especially our generation, being cheap with, showing off their money in forms of the
No,
big home, the nice flashy cars, the
no.
handbag, the trip.
I thought I saw the car you drove up to my office in. Don't think I didn't see.
Yeah, but like when
Starts
it
with
comes
a
to your
starts
health,
with an L and rhymes with Nexus.
yes, they do, right? Every single, and we do the same for our children. You see 16-year-olds, even at my kids' school, that are like they've got their L's and there's BMWs in the parking lot and like brand new Teslas. And but these parents might be suffering themselves and can't spend that $200 on their own health or their blood work or looking
They're
into.
not used to it. They're not like this is it's not a priority because nobody made it a priority for them. And so I'm gonna break that down. I'm gonna
Yeah,
break that completely and identify all of the areas that need to change in
yeah,
order for that to be broken because mm, literally lives matter here.
yeah,
Like human beings' actual lives for Indian people make up the cardiac wards of every hospital here. We make up
yeah,
the inflammatory bowel disease wards of all the hospitals here. We make up all of the chronic health conditions that are associated with inflammation, insulin resistance, diabetes. And we're just going to let that happen?
yeah. Why though? Why South Asians? Like, is there
We are
research?
the most resourced group here, and we're
Yeah.
just going to let that happen?
Yeah, no, we shouldn't be letting that happen. We should be actively investigating what's causing this inflammation that's bringing all these metabolic diseases into our laps. Because
Yeah.
if we
That
don't,
involves testing, that involves paying the money, and that
yeah,
involves caring.
it's
So
simple. Yeah,
if there's any message there, that's it.
that's it. Yeah, no, that's what I was gonna say. What would your message be to probably all the women tuning in that are probably tuning in because they're somewhat suffering from symptoms or not getting the right answers and are looking for answers. I
That's
guess,
it. Just honestly, just pay for it.
yeah,
You're gonna struggle if you don't.
yeah.
Um, Good luck otherwise, but like just like you're worth it. You really are.
Yeah, no, thank you so much. Thank you so much for your time today for this discussion. I cannot wait to bring it back to our community. I think a lot of eye-opening statements made here and a lot of information that you gave us that even I didn't know and I wasn't aware of. And I'm gonna, shout it as much as I can to people.
Please do.
Yeah,
It matters. Thank you
I,
for doing what you do. This is
yeah,
very important. Thank you for reaching out to me.
yeah,
It's the pleasure. It's an
yeah.
honest pleasure of
Yeah.
mine.
No, and I think I am going to reach out to you like as a patient as well, because I am,
Ah,
like I had said, going through things and I'm not on HRT yet. I have dabbled a little bit in progesterone and saw, a really good shift. But yeah, I think I definitely will reach out to you and
happy to
consider.
help.
Yeah.
Yeah,
Thank
yeah.
you, Bobby. Yeah.
Thank you.
Yeah. I'm just gonna